So this week we're looking at the knee, again with squatting type activities. Sometimes you can get a little gunky in this outside aspect of your knee, a little lateral knee pain. Oftentimes that's attributed to the IT band. It can also be attributed to a lateral meniscal problem. However, you do have this other small joint right on the outside of the knee that might be giving you some issues. Let's talk about that real quick before I show you ways of addressing that outside knee pain. All right, so what we have here is the human body, and you'll see that we've got the knee that I'm going to zoom in on, and you'll see that the more common portion of the knee that people think of is this part here and the joint up here. But what we're looking at is this little guy on the side here, which is the proximal tibiofibular joint. That joint, when we go into full knee flexion, needs motion to it. It needs to get out of the way. And you can see here that the top portion of the fibula, or that outside bone, sits just behind the knee. So when you bring that knee into full flexion, it needs to be able to move out of the way. The mobilization that I'm going to show you in a second here is how we help move that sucker out of the way. All right, so we've talked about the stiff joint on the outside of the knee and how we can help really get that moving is a simple technique that's done in kneeling. So if I go into this kneeling position, I'm going to identify a little bump on the outside of my knee. It's actually a little bit down from the knee itself, so right around this area. That bump is your fibular head. You're going to take this part of your palm, the little fleshy part. You're going to go to the middle of your calf and you're going to just press that fleshy part out towards that bump. From there, I'm going to let my ankle relax, and then I'm going to press down, and I'm stretching down as I push to loosen that joint up. I can also add a little bit of knee flexion. So down, flex, down, flex. And that whole thing is just trying to get that area to move a little bit more. So we've talked about the joint on the side of the knee. We're also going to need to talk about some of the muscles. So let's go ahead and zoom back in here. And when I zoom back in, I'm going to turn this leg sideways. Now, real deep in there, right around this area, is that joint. So it's hidden by the muscles, but it's still in there. And you'll see there's a lot of muscles that cross that. One group of muscles is the fibularis muscles, also called peroneal muscles. Now, these muscles, if that joint is unhappy and it's giving you some pain with that squat, a lot of times these muscles will also be sensitive and will be tight. So we need to work them out. I'm going to show you how to do that. But before I do that, there's one other muscle that can also give you some fits with that deep squat and outside knee pain or lateral knee pain, and that's the gastroc. Good thing is it's the exact same technique we're going to use to hit both that as well as the fibularis or peroneal muscle group, and that's what we're doing next. Okay, so we've talked about improving some of the motion at the joint out there, but remember that you've got muscles that cross there, the lateral calf and some of the peroneals. What we're going to do to work those out is just using the good old-fashioned foam roll. So if I put this foam roll down, I'm going to come across the top and then set it up so that it's right underneath my calf. From there, in order to get that outside lateral gastroc, I'm going to rotate my leg over. I might even have to bring my body weight across to really get into it. And then from there, you're going to just shift backwards or forwards until you find the spot. And you just work on it. You can go up and down. You can also go across as if I'm trying to saw into that muscle. Now, in order to get those peroneals, which are on the outside of the leg, I might have to lay on my side, put my body weight across the top, and then glide back and forth, really getting into it. I can add a little bit onto that by moving my ankle back and forth or up and down, all of which are awful. But these are good ways for you to improve some of the function of those muscles, as well as decrease some of that discomfort that you get on the outside of the knee with that squatting motion. Let me know if you got any questions.